September is Pain Awareness Month, and Floridians may soon be seeking relief through medical marijuana. ABC7's Alex Redmond has an exclusive interview with the first neurologist in Sarasota certified to prescribe marijuana. Alex?
Thanks, Haley. Medical marijuana is perhaps the most controversial treatment for pain ever debated, legal in some states, but according to pundits, like it or not, medical marijuana is coming here to Florida.
Physicians were allowed to take a test and be certified to prescribe this high CBD, low THC marijuana.
Dr. Aung-Din is the only doctor in Sarasota and one of only 2 neurologists in the state of Florida certified to prescribe medical marijuana.
There's a lot of stigma attached with medical marijuana and marijuana in general, and it's the most controversial compound I've ever come across.
This begs the question, why are we okay with something like this that's lab created to help ease ailments, and we're not okay with something like this that comes from a plant and is naturally derived?
Being a gateway drug on the one hand, but also miracle cure for such conditions as seizures on the other hand.
Medicinal benefits of CBD from marijuana are numerous.
CBD works for seizures, for pain, for inflammation, for anxiety. We know that.
What we don't know, says Dr. Aung-Din, is the way in which CBD and THC work in combination with other cannabinoids. The marijuana plant has more than 80 cannabinoids, and each has a different medical effect.
Florida has been quite conservative in that we're going to be only allowed to use high CBD, low THC, less than 0.8% of THC.
The same combination as the Charlotte's Web strain, says Dr. Aung-Din.
But CBD is also available in hemp.
Hemp is legal in this country, and it has the same properties. Dr. Aung-Din treats more than 3,000 patients with hemp-derived CBD topical cream, and adds the states are now challenging the federal government in regards to medical marijuana.
Marinol is a synthetic version of marijuana which is used for nausea and appetite, and it's been on the market for years.
Marijuana, explains Dr. Aung-Din, has been in use for medical purposes thousands of years BC.
And even in America, in the 1800s, it was used for a lot of medical ailments.
Of the more than 65,000 licensed physicians in the state of Florida, only 42 have been certified to prescribe medical marijuana when it becomes available, says Dr. Aung-Din.
Once it becomes available and there's the demand and we see the efficacy of the medical marijuana, more physicians will accept it and prescribe it.
Dr. Aung-Din raises an interesting point. On one hand, he says the federal government classifies marijuana as a controlled substance category 1. That's like heroin. On the other hand, they say that there's no medical use for marijuana. Yet in 2003, the U.S. government filed to have medical marijuana patented under U.S. patent law. Interesting.
Yes, very interesting. And now that some of these doctors have been certified, when will people be able to fill a prescription?
Well, Dr. Aung-Din says he thinks it's going to be around the first of the year, and the reason is we have to wait for those 5 certified pharmacies to be named, and once they start growing it, because it has to be grown at the same facility that it's distributed, then it will be up and running, all being well.
And then what about the medical marijuana, and what form will it come in when they do get these prescriptions filled?
Well, he said that it will probably be available in a myriad of forms, including pill form, suppository. You can smoke the marijuana cigarette, and also injectables and creams, just like the hemp. So lots of choices out there for people.
All right. Thank you.